Based on your unique needs, your healthcare professional will develop a feeding plan, including the formula to use, how much to feed, and a schedule for feeding. He or she should evaluate you regularly to ensure you're getting enough of the right formula. In addition to formula, you'll need a feeding container. If the container does not have an attached feeding set, you'll need tubing to connect the feeding container to your feeding tube. Ask your healthcare professional how often you should replace your feeding set and container, and how you should care for them in between feedings. To begin feeding, you'll need a syringe, clean cloth, a cup of clean warm water, and possibly a container for safely storing unused formula. It's important to use a 30 milliliter or larger syringe because smaller syringes generate too much pressure and could damage the feeding tube. Always wash your hands to prevent contamination before preparing the formula and before touching the feeding tube, tube site, or feeding equipment. Wash with soap and water. Rinse thoroughly. Dry with a clean towel. Let's look at how you prepare the feeding.
I'm going to take my formula, I'm going to shake it, then I'm going to open it. And now I'm going to pour it into a measuring cup. I'm just going to date and tie my bag.
Attach the feeding set to the container, if it is not pre-attached, and close the clamp. Pour the formula into the feeding container. Hang the container on an IV pole or wall hook. Cover any unused formula and write the date and time on it. Store it in the refrigerator. Follow the instructions for gravity feeding or pump feeding. Your healthcare professional will tell you which method to use. Make sure your feeding tube is in the right place. Generally, correct tube placement must be confirmed before each intermittent feeding. When feeding continuously, placement should be confirmed every 4 to 6 hours or as directed by your healthcare professional. There are several ways to confirm tube placement. Because no one method is foolproof, always use 2 methods each time. We will discuss the 2 most common methods of placement confirmation used by patients at home. It is important to follow any specific instructions provided to you by your healthcare professional. You can confirm placement of a gastric tube by checking the fluids drawn out of the stomach. Begin by connecting a clean 30 milliliter or larger syringe to your feeding tube. Slowly pull the plunger back until you've withdrawn a few milliliters of fluid from the stomach. As a visual check, the fluid should look like formula or be mostly clear to slightly yellow. This indicates that the fluid is probably stomach contents and that the tube is in place. To confirm placement of standard G tube and J tubes, measure the distance from the skin to the end of the tube. When the tube is first placed, record this distance and refer to it every time you check your tube placement. Always compare the measurement you take with the number recorded after the tube was first placed. If there's a difference in the measurement, you should contact your healthcare professional before giving the feeding. Whichever method you use to confirm tube placement, if the feeding tube is not in the right place, do not feed. Call your healthcare professional right away. Good positioning during tube feeding will help reduce your risk of aspirating or breathing formula into the lungs, which can cause serious problems. Do not tube feed when you are lying flat. Lying flat during tube feeding can cause vomiting and/or coughing. Remain in a raised position for at least 1 hour after the feeding. Your healthcare professional should evaluate you regularly and track your weight and height to make sure you're getting the right kind and the right amount of formula. You should keep track of the amount fed as well as medications and any extra water you take. Record this information in a notebook to share with your healthcare professional.